Okay. So welcome, everyone. I'm still trying to figure out how many people there are online. As we said that it's a small but select group in the room. So thank you very much for those of you who have joined in person, and thank you to everyone else who is online. My name is Sarah Bennett. I'm the director of the Health Systems Program, and I'm delighted to host this second in a series of health system program forums. The first was around AI and health systems, and then this seemed like a really important and timely topic to have a follow-on discussion about. I wanted to really briefly set the scene for this conversation before I go ahead and introduce our speakers who are both in the room and on the line virtually. Obviously, the history of international health is a long one, and I would think that partnerships have been central to much of that history. And there's also, as Prakriti will talk a little bit about in a minute, a sort of long history of academic study around partnerships in international health or global health, and what makes them work, and how can we ensure equity and appropriate accountability and transparency through those partnerships. But I think that during the past few years, there has been a greater focus on really thinking through the issues of equity in international academic partnerships and in global health. And that's obviously spurred in part by the increasing calls for decolonizing global health. But I think it's led us all to reflect more on, what does it mean to be a good partner? How can we change our behaviors so that we're better partners? And also sort of being cognizant of the fact that we work in an ecosystem which in many regards limits the way that we can do effective partnerships. And actually some of Prakriti's own work for her doctoral dissertation is beginning to look at that broader ecosystem within which we work, and in particular the sort of financing partners and how funders are changing their policies around partnerships. And I think that those ecosystems affect things like how funds flow, they affect access to publications, they affect how people get trained and where they get trained. So it seems that this notion of partnership and how that is evolving is a really timely one and a really important one to sort of address some of the long-lasting inequities and structural determinants of how we work. And I know that there's a lot of interest within the department and beyond in terms of being able to to think about academic partnerships in global health and how we can approach them in an even better way going forward, and really ensuring equity, transparency, and accountability. So I think that this is the sort of focus of the seminar, and in particular beginning to think ahead to the sort of medium to long term. What do we envisage? These partnerships? How will these partnerships evolve into the future? What is our vision for them? What would be good partnership practices? So I'm really delighted that we have such a distinguished panel to join us today. I'm going to introduce them now, and then and talk a little bit about how we'll organize this session, and then sort of hand over to our panel members. So our first speaker is Prakriti Shrestha, who's here in the room with us. Prakriti is a third-year PhD student within our program and department, who's being advised by Jo Ali, who's sitting right here as well. She received her MSPH from our school and is originally from Kathmandu, Nepal, but received her BA in biology from Grinnell College and has been based in the US since then. As I said earlier, Prakriti's current research looks at the role of funders in terms of enabling partnership equity in global health research. And she's also a part of the Power of Partnerships committee within our department. Prakriti, in addition to her work on partnerships, also conducts research on health workforce, as well as the ethical, legal, and social implications of NCD monitoring through mobile phone technologies. So quite a diverse portfolio. And then I'm really delighted to have two colleagues join us online, and it felt like this topic was really, really important to hear the perspectives of colleagues who are based in low and middle income countries, who are frequently our partners, and maybe don't always get the opportunities that they might like or need to share their views about how partnerships should work. So firstly, we have Fadi Al-Jadali, who is a professor of health policy and systems and former chair of the Health Policy and Management Department in the Faculty of Health Sciences at the American University of Beirut in Lebanon. Dr. Al-Jadali is also the founder and the director of the Knowledge to Policy Center at AUB, and he holds an adjunct position at McMaster University in Canada. And he's got long-term links with Canada and Canadian universities after he did his PhD there in public policy, and he also held a senior position with the Ontario Ministry of Health. I came to know Fadi well when we worked closely on Health Systems Global, which many of you may be aware of, and he worked as part of the executive leadership for that society, as well as leading the program committee for the Global Symposium on Health Systems Research in 2020, which some of you will remember was an odd year to have a global symposium in. Fadi's main research is actually around knowledge translation, governance, performance reporting for health systems and organizations, quality of care and accreditation, as well as human resources for health. So thank you so much for joining us, Fadi, particularly in the evening, your time. And then we also have Suzanne Kiwanuka. Thank you, Suzanne. It's nice to see you again. Suzanne is a senior lecturer, and I think you probably know many of the people in the room. There was a wave, I think, from the room at that point, Suzanne. Suzanne is a senior lecturer and the head of Health Policy, Planning and Management Department at Makerere University School of Public Health. She also has substantial experience in health systems research. And again, interestingly, and I hadn't figured this out before I invited the two of you to speak, but she also has a lot of expertise in the evidence to policy domain. Dr. Kiwanuka has long-term collaborations with the Cochrane Centre, particularly the Effective Practice on Organisation of Care Group in Oslo, and the Evidence for Policy, Practice and Information Coordinating Centre, the EPI Centre at the Institute of Education, London, both of which sort of focus on synthesising policy-relevant evidence. She has also worked quite a lot in human resources for health, but also has a particular focus on maternal and newborn health and implementation research to extend services to those populations. Dr. Kiwanuka holds a doctorate in oral epidemiology and international health from the University of Bergen in Norway. And then our final panel member, and I'm going to give a rather shorter introduction because I think many of you will know Dr. Walson well. Judd Walson is a relatively new, I don't think I can still say new anymore, relatively new chair, whose own research focuses on identifying populations most vulnerable to preventable deaths and intervening to improve child survival, growth and development. And he's conducted numerous trials with colleagues across the world addressing poor nutrition and infectious diseases. But I think one of the reasons why we asked Judd to join us today was because one of the consistent themes that he has voiced from early on in his engagement with us has really been about the importance of rethinking and strengthening how our department collaborates with partners across the world, and in particular, how we can become a better partner. So we were hoping, in terms of the sort of run of show, to hear a little bit about Prakriti and her work, in particular, sort of focusing on different dimensions of partnership. And then to go to our two external speakers, Dr. Al-Jadali and Dr. Kiwanuka, for some brief reflections from them about what makes a good partnership and their vision for how North-South partnerships in particular might evolve into the future, acknowledging that South-South partnerships are also going to be really important. And then finally, we will come to Judd for some reflections, perhaps coming more from the perspective of the Bloomberg School. For those of you who are online, we've set this up through a webinar, so you will not be able to raise your hand, jump in and talk, but we will be keeping a close monitoring of the Q&A box online. So please, as we go through this session, please jump in, raise questions. Those of you who are in the room, you can stand up, shout, raise your hands, dance, whatever you feel like is the best way to intervene. So I'm hoping at the end of this, we're going to try and keep the interventions, and I realized I've talked quite a lot. We're going to try and keep the interventions relatively short and then hopefully have a good discussion afterwards. So on that note, I'm going to hand over to Prakriti for her introductory presentation.
All right. Well, thank you, Sarah and Melissa, for organizing this event and inviting me to speak today. I will be presenting a review of toolkits and frameworks for evaluating international research partnerships. I hope that this presentation can serve as a starting point for the panel discussion today. So for the last few months, Dr. Chelsea Maudlin and I have been conducting a scoping review of toolkits for global health partnership equity as a part of our work for the Power of Partnerships Committee within the Department of International Health here at Hopkins. This committee is chaired by Dr. Chizoba Wunodi and is made up of faculty within the department who have interests and experiences with partnerships in different regions of the world. In this study, we aim to identify and systematically review information available on global health partnership equity toolkits, focusing on the themes and topics included in each toolkit, the motivations and development processes for each toolkit, and the empirical evidence for the successes, challenges, and limitations of these toolkits on global health partnership equity practices. So this is a list of the toolkits that we included in our study. These toolkits are designed to evaluate research partnership equity and to help with the implementation of partnership equity principles. They're available in the form of surveys, guided questions, and checklists, and they can evaluate partnerships retrospectively or prospectively, and many are structured based on different stages of research or on different values of research. Most toolkits still originate from the global north, but also claim or cite that they have input from the global south in their creation. As you can see from this list, there are a number of toolkits outlining recommendations for equitable international research partnerships. And while all of them stress the importance of fair, equitable, and inclusive practices, the meaning really varies across the toolkits. The most comprehensive effort to address this issue is the Research Fairness Initiative, which comes from the Council on Health Research and Development. And this is a list of objectives and recommendations generated by expert consensus, including LMIC stakeholders. The RFI is designed to target high-level institutions involved in multiple partnerships to critically reflect on current practices that relate to fairness and equity. And other toolkits may focus on individual partnerships, researchers, funders, or other actors. With the proliferation of guidance, principles, and toolkits relating to partnership equity, we identified three main scoping reviews that discuss the elements of North-South research partnerships. So Voller from 2022 did a scoping review of principles, guidelines, and frameworks which have been developed to guide North-South research partnerships, reviewing data up to 2020. Ware was a review of qualitative studies and opinion pieces on experiences of North-South partnerships, and Monet reviewed principles of good global health partnerships. Our scoping review focuses on toolkits that aim to help evaluate and implement partnership equity principles. This table here is adapted from the recent scoping review by Voller and compares themes across these reviews. The themes from our review are shown here in green. And this table really just illustrates that there are common themes between these reviews, between all these different guidelines and frameworks, but there's no singular framework that has all overlapping themes or consensus on the essential elements of partnership equity. In our review, we found that toolkits often cluster themes based on stages of research. This is not to say that these themes are not relevant to other stages of research, but that each theme can be presented in the context of the research stage, from pre-research or planning stage to research implementation and to the post-research stage. There are also certain themes that are shown here in orange that represent the desired values or elements of partnership equity across all stages of research. And in the next few slides, I will present some example questions or indicators from toolkits that correspond to the themes that have emerged from our review so far. These are themes you are most likely familiar with and have experienced in your own research partnerships. So at the pre-research stage, an important theme is research agenda setting, which involves setting partnership and research priorities. An example question from a toolkit was, describe if and how your organization determines the health and health research priorities of the countries, populations in which you conduct research. Another theme was the clarification of roles, responsibilities, and objectives, which refers to the delineation, clarification, and expectations regarding individual partner and investigator roles and responsibilities within the partnership. A question was, have members of the partnership jointly negotiated and agreed upon the roles and responsibilities of each member? Third is governance or oversight of research and partnership activities. A question might ask about the formal governance structure that has been established for projects. And lastly, under the theme access to financial and non-material resources for supporting the partnership, question like, how does your organization measure non-financial contributions of your partners? Could be seen as a helpful probe for partnerships. During the implementation of research, the capacity strengthening, which refers to building scientific and administrative capacity of partners, research infrastructure, and ensuring bidirectional capacity strengthening, where there is an exchange of the knowledge and strengths between partners, was seen as an important theme. Furthermore, utilizing LMIC research infrastructure or using pre-existing infrastructure, including hiring local staff, has been discussed as an important theme. This may be linked to questions like, how does your organization decide on bringing in consumables from outside the country in which research is being conducted? These types of themes can help promote investment in local systems rather than reliance on foreign systems. Another theme is bilateral ethics review, where review should be sought from both LMIC and HIC sites to ensure competent ethical review of a specific research project that is based on understanding of the local context. Another theme is culturally competent data collection and analysis, which references the cultural context of the primary research site. This may address whether the data and methods being used are aligned with the political context, policies, social structures, and systems. After the research activities have been completed, toolkits often considered post-study data and intellectual property access and management as an important theme. This refers to who has access to curate, store, and manage and own the data generated by the research. A question asked was, how does your organization deal with the rights of use of data from studies in which organization is a partner? Another theme was the promotion of research or the distribution of professional recognition and credit for research activities. This can refer to authorship criteria, opportunities to present at conferences, community presentations, and language of publication. And lastly, the dissemination and innovation theme refers to the release and distribution of research results, including how results translate into future innovation or research, and how they may impact policies or practices in the research communities. A toolkit may ask you to describe how your organization ensures that research partnerships promote innovation. And some themes were discussed as important across all stages of research. The first theme is diversity and inclusion in the partnership, which should ask if your organization has a policy in place for the participation of women in science at all levels of research, for example. The next theme, accountability, is a system for which individual, partnership, or sponsors are held responsible for the actions and outcomes for the partnership. This may ask if goals have been reported or formalized so that they may be monitored. Trust is another important theme that refers to the confidence in and mutual respect of each partner. Toolkits discussed how trust is built over time and over long and repeated collaborations. Partner engagement refers to the involvement of local investigators throughout the research project process, and a toolkit may probe you to think about how partners are engaged at all stages of the research. Lastly, sustainability considers the longevity and the smooth transition of partnerships. Toolkits often spoke for the need for long-term investment in partnerships, which leads to sustainability and greater impact of findings. So these were some of the key findings that have emerged from our preliminary data analysis of this review. We hope to further critically analyze how these themes or topics were chosen, as well as the utility and the applicability of the toolkits as we continue our analysis. And with that, I'd just like to thank you all for listening and look forward to hearing thoughts from everyone in this discussion today. Thanks. I'll stop sharing.
Thank you very much indeed, Prakriti. You're still attached. I think that we're going to go straight through all of the speakers and then have a discussion afterwards. So I'm delighted that we can hand over the floor to Dr. Fadi El-Jadali. And Fadi, if you can take 7 or 8 minutes to provide some reflections, I think, in particular, as we've discussed earlier, about how you see the future of international academic partnerships for global health emerging. That would be wonderful. Thank you very much.
Thank you, Sarah. Thank you, Prakriti, for the very good presentation. Thank you, Sarah, for giving us at least some, I think, a moment to reflect and create a space for this type of conversation. I have to say, partly a little bit difficult conversation when it comes to academic partnership. Prakriti, I enjoyed your work and the framework that you put forward. I have in my short, I would say, intervention, I would actually reflect a little bit on what we have learned over the last many years with this type of partnership, reflect also on what's presented, but more importantly, talk a little bit about how we see the future when it comes to the academic partnership. I have to say that, reflecting on the experiences in engaging global partnerships, still there is I have to say there is a mismatch with between what global academic partnership can achieve and what we are currently achieving. And this is really due to many reasons, including geopolitical power, and with power come privilege, institutional factors, and other factors, as well as sometimes some of the projects we get engaged in are short-term, project-driven, and defeat the purpose of a real partnership. So when we say achieving sustainable, partnership, this requires, of course, a well-planned, long-term, I would say, equitable relationships between partners. Now, I have to say, and I'm not saying that, we've done a lot of partnership engagement with both global North, global South, and many has been successful, but also we've learned sometime that the North-South partnership in some cases do not equitably create I would say, the international capital, I would say, that we sought by participating organizations. So in some cases, there's a lot of asymmetry. There's arrangement that sometimes favor universities of the North more than the South. And again, we're reflecting on experience. I have to say also in reflecting on in this talk today, I had to engage also with some of my colleagues, because also we had a lot of engagement that we've done with different universities. So the contribution to that partnership can make to the rule and aspiration of universities are sometimes compromised by different, I would say, operational things at the university level, by structural ones, by cultural inequities, and sometimes we feel that the partners from wealthier and more or highly resourced settings, sometimes they have a much more dominant role at a certain level of the partnership in terms of the design, implementation, grant management, publication. But again, I'm not generalizing, but I'm just reflecting on this. So I think what we need at this stage, a little bit more of a value-driven, I would say, progressive academic partnership model that is built on equity, mutual benefit, growth, sustainability. I think what we have heard so far. So that's why the proposed framework in the presentation, Prakriti, that has made is actually a step forward in ensuring I would say, a much more equitable partnership at all levels of research, pre-research, during research, and after research. So, and I definitely I echo what Prakriti mentioned when it comes to the pre-research. So there's certainly the starting point of the partner is not just the research agenda. It should start with developing, in fact, a shared vision on the partnership itself. So we need to, as partners, we need to identify shared goals. Shared, I would say, define concretely the element that we should actually be the form and the basis of the partnership. And during the research phase, we need to, again, build trust and nourish that relationship building. We need to more adopt the principles of inclusivity, as already mentioned, and also learning how to work together, because I think this is an outcome in its own of how we actually learn, sustain, and scale up this. In the post-research phase, certainly we need to mention, that I think I agree with the theme already mentioned, but I think we need to discuss, issues related to publication, dissemination, data sharing. Sometimes this actually you often come after and as an afterthought, I would say, of the partnership, while there should be an integral and agreed upon from the very start. So what I would say, I would emphasize, I think that sometimes things are overlooked in partnership. One of them is sustainability, and this has already been mentioned, the framework. Capacity strengthening, which is really also very critical. Shared accountability, including monitoring and evaluation, how the fund will be used, how we can all ensure that there is alignment on how the data is used and indicated, etc. And also, I would say, solidarity, which entails certainly collaboration with the goal of ensuring mutual benefits. And that's why it's very important by taking into consideration partnership is an investment, and I think we need to look at it beyond just only a project. Now let me go to the second part of what I wanted to mention in terms of what we have learned. So we've done some different engagement, different institution, global north, global south, and from that experience, I think I want to underscore a little bit some elements that we have learned. And I think commencing with an inception, I would say maybe pilot phase to ensure there is a space for testing, adapting, and learning, and how we can actually, work on the scope and the activities of the partnership before scaling it up. So we cannot go big quickly, and this requires some time and some investment and also trust building. Having clarity on the purpose, goal, and objective of the partnership, I think this should be really very clear right from start. We need to make sure that we have a clear division of labor and identification of responsibilities, joint rights, obligations, and this has to be also cleared in the contractual cooperation agreement at the institution level and not at the individual level. So we're talking about institutionalization of the partnership, which is really should go beyond person to person, because these are institutional arrangement. I have to say also from our learning that we need also work very well on and consider the right partners. So well consideration of the partner selection, clarifying the role of each partner, responsibility, shared understanding, short-term expectation, long-term. All this will help in building really trust. So it's very important that we need to ensure that there is a dedicated time being provided and invested in this relationship strengthening, relationship building, trust building. That's why the governance structure of the execution of the partnership is very critical, and that's something even at the university level we should learn more and more in terms of how we consider this type of agreement. And I'm not talking about comprehensive legal framework, but of course, we need to work around the agreement on the intellectual property, the data sharing, the ethical consideration, making sure there's an equity in partnership at different levels in terms of this. But also there is also sufficient, I would say, resources that need to be making sure. I think this will help actually creating a firm foundation and good practices. So time, I would say, is very critical, and we have a lot of successful experiences with partners that we have sufficient time, we build trust, we learn, we actually scaled up, we engage in joint accountability, monitoring, and evaluation. So there was more of a learning culture, I would say, in this type of partnership. But I want to underscore as well the flexibility in the partnership. You cannot really plan and structure everything right from start. There's a lot of agility and flexibility that we need to take into consideration, because we learn by doing. But let me say, before I talk a little bit about the vision, that if any partnership, particularly academic partnership, is likely to be ineffective if the partners don't share the same values, don't have rules of engagement, don't have shared challenges, they don't share the risk, I would say, that if there's no details to the partnership structure and governance, that even if partners are not able to deal with issues related to conflict of interest and others. So these are important elements also consider. Let me finish by saying, I would say, in terms of the vision, what we would like to see in terms of the vision for this type of partnership. And I have to say, we would like to see more and more academic partnership that are characterized by deeper commitment to collaboration, inclusivity, innovations. There's a lot of emerging trends in global health issues that cannot be addressed, and I don't want to go into it for the lack of time. A lot of global challenges that cannot be addressed except by effective, workable partnership among academic institutions. I think we learned the hard lesson from COVID-19, to be honest with you, in terms of that. So the traditional model of sporadic collaboration, isolated projects, etc., I don't think this will actually be effective in addressing global challenges. And the broader, let's give you an example of the Sustainable Development Goals, where many countries are actually much behind in achieving those goals. So what is the future? How we would like to see it? We would like to see a future that is really characterized by interconnected ecosystems, learning ecosystem, and not ecosystems, because this is also a big issue when it comes to equity, when it comes to power, when it comes to privileges that come with the power. We would like to see that. We would like to see transdisciplinary collaboration. So we're actually, of course, looking at it and trying to cross or bridge different disciplines and avoid the disciplinary silos in terms of working. We would like to see, more of equitable access and inclusivity when it comes to educational resources, opportunities, ensuring that knowledge and expertise are shared, I would say, equitably. At the same time, making sure that we have shared research agenda for global impact. And I think this is very important. I want to underline that the challenges that we face at the global health, including SDG, we cannot be able to address it if there is no meaningful partnership and good, courageous and committed institutions, academic institutions that share the common values and goals, that really make sure that their research outcome contribute to sustainable development, social justice, and well-being of communities. So I'll leave it at there, Sarah. I hope I didn't exceed the 8 minutes. Thank you.
You did a great job there, Fadi. Thank you very much indeed. And I think that you said a number of things which will stick with me, and I hope we can come back to in the conversation, starting from your urging us to think from the start, pre-research, to figure out what are the goals of the partnership before we start looking at what the goals of the research are. And I think also your suggestion that we should be focused on learning ecosystems rather than egosystems is something which will be a catchy one-liner for people to remember. But thank you very much for such a thoughtful contribution. I think we can turn now to Suzanne. I'm trying to figure out how to remove the pin in you. Maybe Melissa, you can help me so that I get Suzanne onto the screen instead.
Yeah, hello everyone. Good morning, good afternoon, good evening, from wherever you are. I must say that a lot of what I wanted to speak to has already been covered by the previous speakers, but I think I do have something more to say. I want to start off on this point that North-South partnerships have most certainly contributed a lot to progress in research capacity and technology and tools and methods. It has been so useful, even if they have been fraught with some issues around equity. I can say for one that a lot of capacity has been built, but that does not mean that a lot of capacity has not also been transferred to the North. I tend to think that this has been shared capacity or capacity sharing over time. I have benefited, and colleagues at the School of Public Health, Makerere University, have benefited from partnerships with Europe, with the US, with Canada, at different levels of engagement. But like Fadi said, we have not been intentional we've not been intentional about some of these partnerships, meaning that they have been short-term and we've only been delimited by the funding we have and the project timelines. And oftentimes we've also been restricted to really focus on what the funder is interested in and sometimes what the northern partner is interested in, even if it might not be what the southern partner would focus on if given leverage to actually make use of the resources available. So that has been a source of, I would say, discontent or disparity. It has left a feeling of dis-ease where researchers in the South have been feeling like, I would use this word, data collectors, and also because of the hierarchy in terms of the research partnerships, where we have viewed the northern partners as the seniors and then the research partners in the South as the juniors, and you get the instructions. So the power generated by funding creates that kind of dynamic. But of course, a lot has been achieved and a lot has also changed. The partnerships have changed. The way we negotiate agreements have changed. I can give you an example that about 4 weeks ago, I got a contract from a northern partner who we are working together with. And in the contract, it was stated that the data belongs to the North. And the grants office at the School of Public Health said, no, that is not going to happen. The data belongs to all of us. And if anyone wants to use it, we are going to actually negotiate how to use it rather than automatically assuming that if you paid for the data and we have collected the data, it belongs to you. So that has changed a lot. In the past, that could perhaps pass. So I wanted to speak to some of the things I see going forward. One is we need to unlearn a lot of things. We need to unlearn things we've taken for granted, because I see North-North partnerships differ greatly from the North-South, and also they differ greatly from the South-South, and I've been privileged to experience all of them. The fact that we start off partnerships with cultural differences, political differences, technology differences, infrastructure, so many differences. It means that we really need to know where we are starting off and try to bridge the gap. And even if all the gaps can't be bridged, can we understand some of the dynamics which drive the partnerships? We also need to be intentional about what we want these partnerships to yield. First of all, they shouldn't be limited to the funding cycle. They shouldn't be limited to individuals. Some partnerships have been focused on individuals, and the individual keeps the whole partnership running. But being intentional will enable us to build a more robust future in regard to partnerships. The third thing we need to look at is Southern institutions are really being courted. So the requests for partnerships come in from all sides, and most of the time you will see the Southern institution really considering whether one partnership is worth pursuing, given the established long-term relationships and experiences. So all these are things we need to think about as we move into the future. The fact that we need to build the mutual respect, the mutual benefits, the equitable resourcing, equitable labor, even the labor distribution. How is division of labor done? Okay, and we also need to consider the fact that sometimes research methods move much faster, or research technology moves faster in the North as opposed to the South, and try to bridge that divide as we seek to make more sustainable partnerships. So one of the things we really need to focus on as well, and this is something I've encountered, in many partnerships, we are told, you know, we shouldn't be paying the PIs. You see, the PIs get a salary from the university, and the PIs actually put in a lot of time, but there is the perception that if someone is at a PI level in a southern institution, they should actually be giving, donating time. And this has oftentimes created a lot of friction, because even if the PIs are paid a salary, they are actually operating on very minimal salaries as given by their universities. We need to look towards research groups and research centers united around a common thread for sustainability. We need to move away from individual, individual-driven partnerships, because they are not sustainable. They are good in terms of building the rapport and the trust, but in terms of sustainability, they might not hold for the long term. We need to look towards negotiating authorships. I can tell you that the South-South partnerships we've been involved in have actually generated so much publication, because there is no hierarchy. Okay, when it comes to the Francophone, I would say there is some kind of hierarchy, because their capacity is a bit different from the Anglophone. But in terms of South-South partnerships, I've experienced a more level kind of networking and collaboration, where you feel comfortable leading, and that needs to be cultivated even in the North-South relationships or collaborations. So I think we need to agree on research priorities as well, so that the research priorities are not predominantly North-driven, but rather an agreed position between the North and the South going forward. But the fact remains that there are lots of partnerships and collaborations across North-South, which then Southern partners are forced to weigh whether they should press on with a partnership if it's not perceived to be mutually beneficial or sustainable. And these are considerations we need to keep in mind. Thank you. Over.
Maybe I just hand straight over to you, Judd, rather than stepping in the way.
Wow, wonderful. Wonderful comments from both speakers, Fadi and Suzanne. And I think, the first step, I think for all of us from the Global North in having these discussions is to recognize our position in all these discussions and realize that we're primarily here to listen. And so I don't want to take a lot of time speaking, but I do want to reflect on a few comments. The first related to one that Fadi brought up, which was this vision of a common mission. And I think, we talk about the way in which structures have evolved that are very disproportionate and very inequitable. We kind of put it under an umbrella term of trying to decolonize this space. And we can talk forever about, what is at heart of that decolonization effort. But fundamentally, I think we need to struggle with this idea that we can talk a lot about what's broken in the system and all of the inequities, and those are very real. They're very important. You heard about many of them from our speakers. But I think what we really need to focus on in addition is what is the vision, the shared vision of what we think our roles and responsibilities should look like in 10 years and 20 years. Because if we don't have a destination in mind, it's very hard to create a roadmap to get there. And so I think starting to share together, as Fadi pointed out, about what that kind of shared vision for collaboration might look like is a very good starting place to align so that we're all working towards a common destination. And in particular for a department in the Global North, what is our role in 10 years and in 20 years? And do we see that we can have a role? for many of us, this idea that we need to always be the global leader in this or the global leader in that. But clearly, we can't be a global leader in decolonization. I mean, that is an oxymoron in and of itself. So what does it mean to be a US-based academic institution pursuing these goals? And I think that there are two kind of sides of this argument. On the one hand, you have people who in the global north who are at institutions like ours, who are very afraid of the potential consequences of power and resource sharing. What would that mean for if all of our grants start going to Uganda and to wherever? And I think that extreme of fear is irrational, and I think we could talk about that. But on the other extreme, I think there are people who feel that the best possible outcome would be the elimination of all US-based and UK-based, international health programs, because they would no longer be needed. And that, the best possible outcome would be that countries in the current, what we call the global south, would be independent and able to run themselves. And I personally feel that, neither is really the correct approach, that the problems that we are trying to address, the truly intractable problems of health and development, require all of our efforts, and that there is a role for all of us to participate, but that those roles are currently way out of balance. And we need to redefine how we interact, but that actually the breadth and depth of experience and expertise that will be required to address these challenges requires all of us to work together. In addition, generating the political capital, the political will, and mobilizing advocacy efforts at the global stage, which is what's required to make these huge, tremendous shifts in funding and in prioritization, will require all of us. And so how do we move towards a future where we can all be part of that conversation in a much more equitable way? I also think that, as Suzanne pointed out, institutions in the global south are increasingly being given agency to make decisions about how they partner in a wonderful way. This is changing. We're seeing the funding landscape, for example, change with the US government, with Gates Foundation, with others, really starting to prioritize funding going directly to the global south. That's fantastic. But what does it mean for our partnerships? Well, I think what it fundamentally means is that when Johns Hopkins or any other institution in the global north controlled all the resources, we could be whatever kind of partner we wanted because we controlled the money. And, people can complain and such, but ultimately it comes down to sort of where are those resources. Now the world's shifting, and now Suzanne's controlling those resources as a prime partner, and she now has much more agency to decide who she wants to partner with. And so if institutions like Johns Hopkins can't be a good partner, what I would call a preferred partner, then organizations in the global south, rightly so, will move on to other partners. So I think this is a really important time for departments like our own to reconsider what does it mean to be an effective preferred partner so that we can continue to engage in a meaningful way. But if we're too late in that approach, if we don't figure this out, we're going to be left behind. And I don't mean that only for Hopkins. I think that's for all institutions. So I think that there is an imperative right now that we need to really think about how do we become a preferred partner. And I think listen to Suzanne, listen to Fadi, listen to other partners about what they're looking for to define a preferred partnership so that we can make sure we're achieving those goals. Lastly, the last thing I want to say is that maybe putting on a little bit of the hat of those who are funding these efforts, those who are driving global decision-making. I think that, for many people, the idea of having equitable partners for the sake of having equitable partnerships is not enough. So that's great. You should have equitable partnerships, fine. But that's not really the goal. The consumer of what funders are trying to drive toward are the consumers are the communities in need. So the populations in need of more equitable delivered health systems, of better health outcomes, they ultimately are the ones that we're trying to impact. So if they suffer as a result of us getting to more equitable partnership, I don't think that the goals have been achieved. But I would argue that actually we are serving those communities far better by having more equitable partnerships. But I think that needs to be part of the conversation, that we're not just focusing on metrics that are process metrics of how do we get into better partnership, but we're also demonstrating that those more equitable partnerships are providing more value in terms of the outcomes that we're achieving. And I think that's where we're really going to be able to move the needle on bringing together our shared vision for why equitable partnership's important with the funders and the political reality that drives the decisions that allow us then and enable us then to have better partnerships. So I think we really need to bring that in. And, you know, ultimately, it's going to be necessary for all of those stakeholders to be on board to sustain what we're starting to see as this transition, which is wonderful to see, as Suzanne said, towards, you know, improving our ability to deliver directly to partners in the Global South. But it's going to take all of us. And I think, as Fadi and Suzanne both commented on, I look forward to hearing more from our partners about how we can serve as a more effective partner in achieving these mutual goals. So I'll stop there. Thank you so much.
Thank you very much indeed, Judd. I'm going to ask Judd and Prakriti to come to stay at the front. We now have a table for you. We didn't have that before, but if there's a, and Melissa, can I have your help so that we can get, if possible, both Fadi and Suzanne up on the screen behind you? There are some questions in the chat which we could go to, but I would like to, if you don't mind, open it to the room first, and then come to just see if there are any questions from people in the room or comments. I think that we've had a discussion which has begun to explore this difficult issue, and I think it's an issue that, you know, creates tensions and concerns on both sides. But I really appreciated I think frank comments from Fadi and from Suzanne about your perspectives on partnerships. Is there anyone in the room who would like to raise a question? Maybe I'll, yeah, okay, Joe, you look kind of reluctant, but why didn't you get us started, and then I'll go to one of those in the chat. Yeah. And I just say to others, all of you who are online, please don't hesitate to type your question into the chat. We'd be really interested to hear your views and questions.
Yeah, thanks. Thanks everybody for the great sort of sharing of insights on this.
Can I just check? Can people online hear Joe's questions? The room should be set up, but can you hear the speaker?
Hopefully, I'll keep talking. Tell me if you can.
Okay.
Great. So my question emerges out of a comment Dr. Judd made, but I think if others want to comment on it, it'd be great. And maybe it's a little bit in the weeds, but you mentioned this idea of interconnected learning ecosystems, and I wanted to focus on the learning part of that, and maybe if you could say a little bit more about what you had in mind there. How can we? What are the mechanics of learning in this institutional environment and then across institutions? I don't know if you have any thoughts on that, but I think it would be helpful if you do.
Fadi, do you want to take it? Did you hear the question first?
Sarah, there was a little bit some disconnect. If you can just rephrase it, please.
Hold on.
Sorry.
Joe's rephrasing it for you.
Yeah, thanks. I was asking you talked about interconnected learning ecosystems.
Yep.
And I was curious about the learning part of that. So what kind of learning do we need to do, and what are the mechanics of that? How do we actually learn about how we are performing as partners, and how do we share those lessons across institutions in a way that feels beneficial to everyone and that sort of thing? So if you want to expand on the learning part, that'd be.
Yeah, no, I think what you know, what I meant by this is that I think we need to certainly move beyond I would say the one-off type of collaboration, but I think we need more to work on forming, I would say, networks that can really integrate students, faculty, researchers from certainly various parts, you know, global north, global south, and have some kind of dynamic exchange of ideas. I think this is one of the, you know, it's a you know, I have to say that with partnership, there's always possibilities. There is a benefit of possibility. So there is more when we have network like this, we'll have more ideas, more resources, even more expertise, I would say, and opportunities for innovations, for new discoveries, for broadening the perspective, I would say, and the knowledge base, and not only for among researchers, but also for students. So this is really what I meant by the more of ecosystem when it comes to learning.
Thank you, Fadi. I don't know, Suzanne or Judd or Prakriti, whether you want to add anything on that point about what a sort of learning. Yeah, Suzanne?
Yeah, I just wanted to quickly say that we need to be more intentional about the way we collaborate. And I can give you an example about the recently created clusters of excellence between European universities and African universities. And these have been created without existing budgets. So these partnerships are made organically, and then they start to build efforts to look for resources. And right now you can see them coalescing and trying to negotiate a partnership on grounds which are not funding driven. So we are not starting off with resources. We are starting off as partners, and then we are setting out a research agenda. What do we want to achieve with the partnership? So perhaps what I'm saying is that we need to be more intentional and not wait for Gates to put out a call and then we quickly look for the partner to join us in this call, because then what brings you together is the funding, and when that is over, you go your separate ways. I think we need to be intentional and build these partnerships even without the funding and see how can we mutually benefit each other. And when it comes to students, I have noticed oftentimes there will be 1 or 2 PhDs for the African countries, could be more. And then you'll have exchange visits, exchange faculty. This has been limited. It has not been really an exchange. In many partnerships, it has been the northern partners coming in. So we need to move beyond research and also look at sharing the technical skills across the two, the North and the South. I think we need to think beyond the research, going to the training, going to the future generations as well.
If I can add to what Suzanne mentioned.
Yeah,
and if I would add, I mean, think thank you, Suzanne. I think this is great, and I would say that I think what should bring us together is the purpose rather than the funding. And I think the funding is an important element, but not sufficient for effective partnership. So I would definitely echo what you're saying. And as this is maybe something, and maybe Judd already referred to it in his intervention. Also, there is, funders should really revisit and redesign and relook about how they are actually funding a program that lead to partnership or nourish or scale up certain partnership. I think even the way we are writing a call for proposal for a particular program need to be revisited by funders to enable to unleash the potential of academic institutions in order to actually move into the journey of an effective, sustainable, scalable partnerships.
Maybe I could build upon the direction the conversation is going in, because it seems to me that, internally we talk a lot about the connections between the research that we do and the education and the training that we do. But it strikes me that often in partnerships, those are a little bit segmented. We have partnerships that are focused on research and actually a fewer number which are focused on effective teaching. And it feels to me like there are so many opportunities for more for better engagement around our educational mission with institutions in the Global South. And I wondered, and this is probably particularly to Suzanne and Fadi, but if the two of you have thoughts as well, have you seen partnerships which really dig into that sort of academic component and exhibit good practice in terms of how they're thinking about building capacity both in the North and in the South? And I think it's also important to recognize that Northern institutions get a huge benefit from those kind of collaborations as well. But any examples that you'd like to point to?
Suzanne, you want to go ahead?
Off the top of my head, I wouldn't say partnerships, because many of them have been individual, senior staff linked to the university offering some sessions of teaching. and also students coming in for a period of time. At one point, we had a partnership with Sweden, Karolinska Institute, where we would actually have joint health system sessions with the students there and the students in Makerere. But of course, this wasn't sustained because it was mostly led by an individual. But I think having such sessions builds mutual respect between the students, between the staff, and then you are on level ground in terms of what you're exchanging, but it also enriches the learning on both sides. And so while I don't have a very good example, I think we've been all a bit too slow on building this kind of partnerships. I think it's a way to something to consider going forward.
And I would maybe add that, you know, over the last few years, we had experience by engaging with a very reputable, academic institution in the U.S. For I would say a fellowship program where we actually had a co-teaching model, co-production of courses or so to be delivered in certain countries in the Eastern Mediterranean region. I think there was a lot of learning on that. Unfortunately, there was no shared vision right from start on the partnership. So this was mostly, I would say, unfortunately, transactional type of engagement because of the funding opportunity and the funders. There was a lot of opportunities for this actually model to be scaled up, but again, for the lack of the different arrangement, when exactly what we're talking about when it comes to the partnership. So I unfortunately, Sarah, I don't have really a good success with stories in that. I have to say two things. First thing, that from the engagement that we have done with different institutions at the level of teaching and joining together a teaching program and delivering together, to be honest with you, we've learned that in fact, you know, the global north can learn from the global south as much as the global south can learn from the global north. I mean, you know, it's many of the sometimes the hands-on teaching and delivery of courses in certain countries, low middle income countries, required also a good understanding of the context, a good understanding of the political economy of health. I would say a good understanding of previous case studies. You can see much of those programs can be strengthened when two institutions coming together or more to develop joint case studies, you know, that actually allow people to think differently and have looked at the problem from a global lens. I think this is really very important. Unfortunately, we're not looking at global health from a global lens. And I think it's very important to see how we can really think about capabilities, capacities to actually enable and join efforts when it comes to that, particularly when it comes to teaching. The one thing I want to add, given that I'm speaking, sorry, that I have to say also we have to, despite the challenges, but at the same time we have to start from the, I would say, glass half full. Glass half full in the sense there has been really some successful engagement at the research level also with different institutions in the global north and the global south. I think my worry with this is that, even I have to say, even with Hopkins, we had really great relationships, and Sarah, we have really successful engagement also with the Department of International Health. I think the question is how we can take those experiences that was built in a way to a certain extent because many people know each other, we engaged together, we saw a joint opportunity, we came together also as professional and faculty members and researchers, how we can take those good examples and good practices, because I think what Judd mentioned is interesting. I like the word, the word he used, preferred partners. I think there is a lot of critical success factor, an element that we tested for what make a good preferred partners. And I think those examples, Sarah, we can build on that to take that discussions at a much higher level. Thank you.
Thank you. Judd, I think you may be trying to come in.
Am I audible if I speak? We grab the microphone.
Yes.
Sorry, to make sure. I just wanted to, I agree with that, all that was said. And I just wanted to highlight two examples that I've seen that I think are perhaps good examples, both from Kenya, actually. One is a partnership between Seattle Children's Hospital and the University of Nairobi and Kenyatta Hospital, in which residents, in pediatrics do a dual exchange program between the University of Nairobi and Seattle Children's Hospital. So for 8 weeks, Kenyan residents come to Seattle, and there's a community health sort of didactic piece of learning. And then for 8 weeks, those pairs, they're twinned pairs of residents, Kenyan and US, spend time in Western Kenya working in a community around community health engagement. And the metrics of what those institutions have agreed on are good, equitable partnership between the two twinned individuals. So there's a lot of other metrics around learning about child health in Kenya and all of this and in the US, but the primary metrics are around really how do you build a good, equitable collaboration. And so it's really a training program designed at its core to build better partnership. And I think that's been very successful. It's been going for, 12 or 13 years, and now has funding to be able to, do these dual exchanges, and it's been very successful. The other one that I would just highlight is the University of Nairobi also was the recipient of an NIH MEPI award, which allowed them to be the prime award on a training program, which now has enabled the development of a PhD program in Kenya. And so while there's a lot of shared research going on between US institutions and University of Nairobi, it's also enabled the sort of the PhD part of that component in Kenya to remain in Kenya instead of having all of the students going overseas for their PhD. And I think that's also been quite a good example, or a potentially good example, of how these engagements can be successful in some ways.
Thank you, Judd. There was a question online, which I thought was an interesting one, which is really reflecting on the fact that lead investigators, both in the South and in the North, often hold multiple identities. And some may be sort of simultaneously based in the North and the South. So I think, we're increasingly seeing excellent scholars who come from the South and the North, perhaps more rarely in the opposite direction. And the question is asking about how are partnerships influenced in such circumstances? What are the ethical considerations that come up in this space, and how should they be addressed? I think that's quite a challenging question, but an important one given the sort of increasing globalization. I don't know whether any of our panelists would like to take a crack at reflecting on that.
Well, I think it definitely is a difficult question, I have to say, to me, there is an element that it's an ethical issue with that. I'm not going to go into the detail with it, but I think my worry, Sarah, that sometimes universities are given the nature of the system, unfortunately, the lot of focus now on metrics, on how much we are publishing, the number of scholars that was referenced, and et cetera, et cetera. So there's a lot of metrics out there when it comes to universities actually using it for the right reason, for sure. But my worry sometimes there is also the lot of I would say just magnification of some of the impact that universities really are doing, and I really worry about that, particularly when it comes to the authors, corresponding authors, and all this type of thing. Particularly with researchers that have more than one hat and more engagement in more than university, particularly global North, global South, etc. So I think this is an issue that need to be considered. I do believe it's committed, and with all the respect to all faculty members, the researchers working very hard in global health. But I think one of the reasons we got educated in the global North, but it's also our commitment now that we are working and living in the global South is to actually contribute to the wellness of societies and advance global health in our context. So I think I still believe, and that's my personal opinion, maybe others will disagree with me, but I think we have a moral commitment here when we decide to actually contribute and be part of the global South and contribute and to research, innovation, and impact. I think that should be our main hat that we need to put at when we are actually working and research and also I would say publishing. And I think one last thing I want to mention, Sarah, that I believe that university education cannot be seen only built on learning from classrooms and instructors and having isolated campuses that are really, I would say, disconnected from societal problem. So I think I think our societies, particularly in Global South, will be best served when we see universities and partnerships, really partnership globally, that commit, in fact, to have partners that can multiply impact. I mean, the whole is bigger than the sum of the part when we come together for the right reason, for the right purpose, and not only worry too much about the metrics and the classification of our university or so. I would love to see a future where we actually think a little bit much more broadly than what we are actually now in. Thank you.
Thank you, Fadi. I realize that we're just a couple of minutes off the quarter past schedule finish for this seminar. And again, like the last one, I feel like this is really the beginning of a conversation. And I think I'm hoping very much that it will be the beginning of a conversation here. But I'd like to give the remaining panelists just a little bit of time to wrap up. And if you have any reflections on that last question from the online speaker, I'd be interested to hear. I mean, I think they were also sort of getting at this issue about, is it good for institutions like ours to be hiring people from the Global South? I mean, obviously, it's up to those individuals to make decisions, but I think it can be a challenging issue there about, is this a good practice or not? But Suzanne, maybe I could come to you if you had any final reflections or wrap-up comments, and then I go to Prakriti and then to Judd. Would that be okay?
Yeah. For me, the way I see it is, even as the universities try to change the way they build these partnerships, which are purpose-driven, we also need to speak to the funders so that they also change the way they put out the calls or assess the calls. Because even from the South, you will notice that there is an imbalance in the access to the opportunities. And it's mostly driven by the way the funding calls go out and they're assessed. So capacity is not the same, meaning that Johns Hopkins might not want to partner with a very weak institution, but it has been built up that way because of a legacy of funding mechanisms. So there are institutions which will historically remain behind, and that needs to be avoided. The other thing I'm getting from this is the need to nurture the young scientists so that they're learning and growing with the senior scientists, not just north-south, but south-south, north-north, to build a more cohesive partnership, because we all stand to benefit from the global issues we have to learn from. Maybe that is what I wanted to say. Over.
Thank you very much, Suzanne. And I think we would all agree about your urge to funders to reflect more on these partnerships and how they can help make them successful. I think it is also part of building this broader ecosystem. And Prakriti, I know that's of interest to you. I don't know if you want to comment on that and other aspects.
Right. Well, I am very interested in the role of funders, but the comment I wanted to add, just a small comment, was about the multiple identities. As a student, I haven't been a lead investigator, but I'm from Nepal and I'm still a citizen of Nepal. So this is something that I struggle with. But the one thing I realized that working and living in the US affords me a lot more opportunities than people that are in Nepal, and even those of us coming to the global north from the global south have advantages beyond some of the students in Nepal. And I think there's still those sorts of power disparities and just inequities that exist that need to be addressed within countries, and about who even gets the opportunity to come to the global north. So that's just what I wanted to touch on. Thanks.
And I'll just wrap up with a couple of thoughts about this. One is I completely agree that there are disparities between individuals from the global south living in the global south and living in the global north. On the other hand, I think not to be pessimistic about this, but within our within the United States, I can say for sure, racism continues to play an incredibly important role in society, and the structural violence that's been perpetuated in the name of racism. And so I think it's important to reflect even within our institution on the positionality of different individuals and what that means in terms of affording power and privilege based not only on race, but on other forms of identity as well. And so I think it's a really important point that we not let this just become about whether someone is residing in the global South or residing in the global North. Partnership means, really being able to see each other as, equal humans on the planet. And that, I think, if we can't clean up our own shop here at home, it's very hard to see how we can be better partners with individuals elsewhere. So I think there is a lot of work that we need to do here that will enable us to be better partners with our partners in other geographies as well. That being said, I do think that in terms of this idea of, is it harmful for us to bring in folks from the global South? And I understand that argument completely. And I also agree with Sara completely that, fundamentally, we shouldn't be imposing our voice on other people's choices. And if people choose to come, that's in they're certainly within their rights. I also think that we become a better place for the diversity of viewpoints and diversity of lived experiences that individuals from other parts of the world can bring to our institution. So I think it's a fine balance, but I think it would be, in my own vision, having an institution that was closed off to partners from the global South in terms of being here and being based here would be harmful. And so I think we want to be inclusive, at the same time recognizing that brain drain is real, and we need to, ideally through equitable partnership, increase opportunities in other geographies so that less people feel the need to find sources of power and privilege in other places, and can remain at home and do the great work that our partners are doing around the world. So I think it's a complex question for sure. But thank you all for being part of this great conversation. I hope it's just the beginning.
So just to close us out, thank you all very much indeed. We have had a lot of people online, although they've kept quite quiet, maybe because I went to the room first. But I would particularly like to thank all of our speakers. You did a wonderful job, Prakriti. Thank you for kicking us off so well with such a nice presentation. And I'd particularly like to thank our colleagues from Uganda and from Lebanon to Fadi and to Suzanne. I think we all recognize that, it's our responsibility in the global North to begin to address some of these historic power inequities, but we can't do it without you. And I'm sorry that this becomes then an extra burden on your plate, but we're really so grateful for the time that you've taken today to be with us and to share with us your insights and your thoughts. And I do hope that this is a beginning of a longer conversation, but thank you to you all. Goodbye.
Thank you for having us. Thank you.
Thank you.
Thank you.
Thank you.